welcome to Healthy Living. I'm Dr. Donald Pelto, and today we're going to talk about how you can get rid of your plantar fasciitis. To understand this, first we're going to look at what is plantar fasciitis. So if you can see on this picture here, the plantar fascia is a little ligament that attaches to the heel of the foot. And it's intimately attached with the Achilles tendon. You see those two little yellow lines. The Achilles tendon is pulling in one direction of the heel, and the fascia is pulling the other direction on the bottom of the heel, and they're kind of playing tug of war. And what plantar fasciitis is, it's an inflammation of that fascia on the bottom of the foot, where it becomes inflamed, it becomes painful. And many people, they start out with a fasciitis, and itis means inflammation. But if you have it for a long enough period of time, it can turn into something called plantar fasciosis, which is more of a chronic condition of the plantar fascia. And the whole goal of our treatment is to reduce that inflammation. And there's no one easy way. People tried a lot of different treatments, and one of the treatments they try is they say, doctor, you know, I've bought 10 or 15 different pairs of shoes, and none of them feel good. And when they say that, and I tell them, you know, the problem probably it isn't the shoe, it's probably your foot. And that's the issue. You can't try to change shoes, get inserts, and all these things, and if nothing works, you need some other treatment options. So let's go to look a little bit more about the anatomy. If you look at the fascia, on top, or actually around and underneath the fascia, there's a whole bunch of muscles. So you see these muscles that are on the bottom of this foot, and the muscle there that's on the back of the leg. The muscles all start in the back of the leg, and they insert into the foot. And if those muscles are tight, if they're not functioning well, many times the muscles, since they're not working well, they cause the fascia to get inflamed. Let me kind of explain a little bit easier. The fascia is something we call a secondary support structure on the foot. The fascia really isn't supposed to do anything, but it's the muscles that start in the calf and they insert in the foot, and if those aren't working well, then the fascia can become inflamed. What do we typically see? We see someone that, let's say they start working out. They work out a day, everything is fine. The second day, the third day, everything seems to be fine, but usually after 3 or 4 days, their heel starts to hurt. Or if they go on a long walk, or if they go to some place like Disney World and they do a lot of walking in an unsupportive shoe, they start to develop this condition. A lot of times it's because the muscles in the back of the calf, they become very tight. They're not working well. And then all that pressure needs to go through the plantar fascia. How do you determine if you have plantar fasciitis? You can try to kind of push on the bottom of the foot. That's a good way. Usually it's right at the bottom of the heel, but there are some other diagnostic exams that you can do. The first picture you're going to see on the top is a picture of an x-ray. This isn't the ideal x-ray because it's a non-weight-bearing x-ray. We can tell that because the foot's pointed down. You would tend to want a weight-bearing x-ray. And you can see where there's that little circle, it's pointing to a spur. Now, the spur usually isn't the problem with plantar fasciitis. The spur is something that happens over years of having tightness of the plantar fascia. To explain it a little bit better, there's a law called Wolff's Law. So if you pull long enough on a bone in one direction, so for example, that fascia is pulling on the heel bone for a long time, that's going to create bone in that direction, and you're going to have a spur. But you'll say, well, that spur needs to be treated. Well, if you get 100 x-rays on people with plantar fasciitis, 50 of them are going to have spurs, and 50 of them won't have spurs. So just because you have a spur doesn't mean you have plantar fasciitis, and just because you don't have a spur, it doesn't mean that you have plantar fasciitis. The better thing to look at is either an ultrasound or an MRI. What I have here is a picture of an ultrasound, and you can see the distance here. It says the right and the left plantar fascia. On the right, there's a shorter distance between the two letters, the two A's that you see. And then on the left one, there's a larger distance between the two letters that you see. And that largeness, that little kind of dome you're noticing, that's actually the bottom of the heel. So the bottom of the heel, imagine that picture flipped upside down of the x-ray flipped upside down. That's the bottom of the heel. And on the bottom of the heel, that's where that plantar fascia inserts. And the bigger problem isn't the spur. The bigger problem is the thickness of the fascia. When the fascia becomes really thick, so for example, instead of 4 millimeters like it should normally be, it's 6 or 8 millimeters, that thickness doesn't allow the fascia to move or to adapt as well, and it becomes painful for people. So it's important to do an ultrasound to evaluate the actual thickness of the fascia. And the other diagnostic exam that can be done is something called an MRI. And an MRI will show you if there's some inflammation down there. It will show you if there's a spur down there. It's a little bit challenging to measure the thickness of the fascia because if you think about the cuts of an MRI, they're usually 2 millimeters in thickness. So it might be a little bit more challenging to measure things and to see everything that's down there. So let's go into the treatment process. How do you treat plantar fasciitis? If you look on the internet, there's hundreds of treatments, and that's where many times it gets confusing. We're going to go over some of the basics. Okay, I like to categorize things in the basics of reducing inflammation, reducing tightness, and then stabilizing the heel. Those are the main things that we focus on when we're treating plantar fasciitis. Let's first start to look at how do you reduce the inflammation. One of the ways to start is to use ice. There's a couple of ways you can do this. You can see in this picture here on the left, someone put a bottle of water in the freezer, and they're rubbing that on the bottom of the heel. They're rolling that on the bottom of the heel. That can help reduce some of the inflammation. Another way is to take a little cup of ice and put it in the freezer, and then you kind of rip around the edges of that cup of the ice. And that massaging motion, you can massage, you can on the bottom of the heel, and that's going to freeze the area, and that's going to reduce some inflammation. Now, if you have a very mild case, icing alone may be helpful, but for most people, icing is in conjunction with other things. The icing isn't enough for most people to get rid of all their symptoms, basically because the ice isn't able to penetrate deep enough into the foot to resolve the issue. Another way to reduce the inflammation are using, if your doctor will allow you, anti-inflammatory medications. There are many different types. There's Motrin, there's ibuprofen, there's naproxen. There are many different types of anti-inflammatories. And where I find people make a few mistakes using anti-inflammatories is that they only take them when they have pain. If you're taking them only when you have pain, you have a really hard time to get that true pain reduction and anti-inflammatory effect in the foot. What I find works a little bit better is to be consistent. So for example, if you're taking Motrin 3 times a day, you take it 3 times a day for a couple of weeks. Once again, take it with food, under the direction of your doctor. Or naproxen is twice a day. That's why I like naproxen a little bit more, or Aleve, because you just have to take it twice a day, and most people forget the 3rd dosage. But to be consistent with it for a period of time of a couple of weeks, you're going to determine if you're able to get that anti-inflammatory effect on the bottom of the heel. There are other ways or other medications that you can take. For example, a prednisone, like a Medrol dose pack, if you're in a lot of pain, that can help reduce the inflammation. And there are numerous other medications that your doctor may prescribe for you. What I find works most effectively when someone comes in, most people have tried the icing, and they've tried the anti-inflammatory, and they're limping quite a bit. The best way to reduce the inflammation, I find, is utilizing a cortisone injection. And everyone may be listening, they're saying, I don't want a cortisone hurts a lot. Well, if you imagine if you're coming in limping and you're having a lot of pain, and if you could possibly leave without pain, it would be worth it. It would be worth it. A cortisone injection can be made up of a concoction of a number of medications. Usually it involves some type of anesthetic, and an anesthetic is used to numb up the area, and then you put different types of cortisone in there. We tend to use a short-acting cortisone that starts working within a day or two, and then we also put a portion of a long-acting steroid as well that may take a week or so before it starts working, but it has a longer lifespan. And a couple of the questions we always get about cortisones is, first, how long is it going to last? Well, for some people, it may last a couple of days, a couple of weeks, a couple of months, or if it's able to reduce the inflammation and you do the other treatments, then it could totally resolve the condition. With cortisone, if you can see here in this picture on the bottom, the 2 of them, you can see it usually goes on the side of the foot. Even though your pain is on the bottom, we normally put the cortisone through the side of the foot. Unless you have a different condition, or something called a bursa on the bottom of the foot, it could go straight through the bottom, but usually go on the side. You try to inject it right at the juncture of where the heel bone is and the fascia is. And there is a new technology. If you look up front here on the top, you'll see that heel bone that states there, and you'll see that needle that's going in. And that needle is shown there utilizing something called a diagnostic ultrasound. So we're going to put the ultrasound right where the fascia is. In this way, you can put a little bit less of the medication in there, and you know that it's getting in the right spot. That's where cortisone is very effective. When you do this with the ultrasound guidance, you can use less of it. Why? Because cortisone, there are risks with cortisone. Some people have allergies to it. Other people, though, what we get concerned with, if you put too much cortisone in one location, that can kind of weaken the tissues in that area, and that can become a concern. You could develop a rupture of the plantar fascia. You could develop weakening of some of the other muscles in the area. So you have to be careful. We always want to use it in the proper location and in the proper amount for treating the plantar fascia. Okay? So cortisone injection is very important to reduce the symptoms of pain that you're having. Let's say you have a cortisone. If you can have the other one, well, you may be able to have it in a couple of weeks. I tend to wait between 2 and 8 weeks between them. I try to avoid doing more than 3 injections in one location. You can do more if it's indicated, but you don't want to put too much in there because you don't want to weaken the material that's in there, the tissue that's in there. And people always ask, well, what happens if I absolutely don't want a cortisone injection? There are other treatments, like we talked about. There's the icing, there's the anti-inflammatories, and we're also going to talk about a couple of other treatment options for the plantar fascia. And this is one of them. This is called Extracorporal Pulse Activation System. Basically, it's the similar technology to shockwave or lithotripsy. Many of you may have heard, if you have a kidney stone, they can sit you in some water, and then they can shoot these sound waves at you. And that's what this system is. Basically, there's 2 pieces of metal inside, and they hit against each other, and they create a sound wave or an acoustical wave that goes through some gel. We call it ultrasound gel. And then it goes into the area where the maximal area of pain is, and usually that equates to the maximal area of thickness that we showed you on the ultrasound. And I kind of equate this to a meat tenderizer. You're taking that area of thickness, and then you're hitting that area, and that's going to help kind of soften up that area. But more importantly, over the next about 6 weeks, it's going to start to send more good blood flow to the area. Because for some people that have this fasciitis, or the other thing called the fasciosis, which is more of a chronic problem with the plantar fascia, there's not enough blood flow to the area to bring the healing components. So basically, this brings some of the healing components, or it's supposed to, over a period of time. We tend to do one of these treatments every week or 2 for 3 treatments. And it's quite effective for people that don't want to do a cortisone, or maybe they've had a cortisone and we're seeing them a couple weeks later and they don't want to do another cortisone for, let's say, 8 weeks, then we can do these series of treatments as well. The one thing you have to remember with this type of a treatment, for a few days afterwards, you don't want to take any anti-inflammatory medications. You don't want to take any Motrin, ibuprofen, because the whole goal of this treatment is to increase the blood flow to the area. And if you're taking the anti-inflammatories, it's kind of taking those good healing components and keeping them away with the purpose of the anti-inflammatories. The second step in this process of treating plantar fasciitis is to reduce the tightness. And as we mentioned before, many people, they have tightness in the back of the calf. Now, I don't see anyone with plantar fasciitis that comes in and they say, doctor, my calf is tight. They don't complain of calf tightness. But many times when you're feeling the back of the calf, there is pain and there is tightness, and the muscles aren't working well. And that's why every doctor that you talk to, or you look at every different site, you're going to find that they talk about using stretching exercises, special boots, special socks. All of these things are used to focus on reducing the tightness in the back of the calf. Why? Because if you can reduce the tightness in the back of the calf, you can reduce the tightness where those muscles insert on the bottom of the foot. And many of those muscles, especially the one that's noted there, the tibialis posterior, that inserts in the bottom of the heel right around where the plantar fascia is. So by loosening up that muscle, you're able to many times reduce some of the symptoms. We find patients when they come in with plantar fasciitis and then we do a series of foam rolling exercises or exercises to loosen up that posterior tibial tendon, many people have dramatically reduced pain just from doing that. That's why massage is so important. Massage can be a little costly. That's why we have some options here of some tools. These are deep tissue massage tools. One is a foam roller, you can see on the top, and that you roll in the back. You don't have to plank up like this person is planking, but that foam rolling can reduce the tightness. Another thing, there's some tools, they're called trigger point tools. They have a little yoga block and a ball, and that ball is able to penetrate deep into that calf area. And there's different types of techniques. The main technique we use, though, is when we have it on the back of the calf, we roll the foot 3 times in one direction, 3 times in the other direction, and then we lift it and drop it down. And you'll find some of these other resources I'll share with you, some actual videos of how to do this. These are our mainstay with treating the tightness in the back of the calf. Many people say, well, I've tried stretching and nothing works. I've tried one of these special socks, one of these night splints, and nothing works. This type of a treatment is really, really helpful for this type of a condition of plantar fasciitis. Another technique, many times that goes in conjunction, is physical therapy. And the reason I send people to physical therapy is because most people need help staying consistent with the foam rolling and these other types of tools that you're using. If you tell someone to do foam rolling twice a day or the deep tissue massage twice a day, many people aren't doing it. And by sending people to physical therapy, they're going to learn how to use the tools better, but they're also going to be more consistent. There's also another type of a technique called the Graston technique, and this basically takes a hard piece of metal and rubs down the back of the calf. And this type of a technique is similar to those other foam rolling and the ball that massages the area, but it gets very deep, and it's able to break up any of the adhesions or the tight components, the tightness in the back of the calf. And amazingly, but just by rubbing back there or the different areas around the heel or the fascia, that can reduce a lot of the inflammation for people, and it can help the healing. Now, I do put some stretching exercises just to be complete. This is a type of a runner stretch. I always say be careful with these types of stretches because many times people stretch incorrectly. Their foot might be in the proper position, in the improper position. Their foot could be twisted in, it could be twisted out. One that's helpful is the step stretch where you go on the edge of the step and you kind of go down very carefully because you don't want to injure anything, but kind of go down and come back up. And that type of a stretch is called the eccentric type of a stretch that can help with loosening up the back of the calf. All these are here for completion. There's also a device that's called a night splint or a similar thing called a dynasplint. Both of these are used for people that have a plantar fasciitis or some other type of an Achilles tendonitis condition. And I explain it's good for you if you have pain when you get out of bed in the morning. This is what this is used for. And most of my patients can't tolerate wearing that boot all night long in bed. They may wear it for a half hour, 2 hours, but for a lot of people it's not that comfortable. And if you're sitting around kind of watching TV at the end of the day, you could use something like this night splint, while you're sitting watching TV, and it'll keep the foot up in the flex position and it'll stretch those muscles. This isn't used for everyone. It tends to work better for people that have pain when they get up in the morning. And then the third component of the treatment, we talked about reducing the inflammation, reducing the tightness in the back of the calf, and now we're going to talk about correcting the heel alignment. So heel alignment is the alignment of your heel. So if your heel kind of goes out, and I'll show you a picture in a second, it's real important to correct that, because if you correct the heel alignment, you're going to stabilize the whole foot. So a very supportive shoe is going to be helpful. I find shoes that have too much cushion aren't that good. It's better to have a nice stable shoe that's going to help stabilize your heel. Flip-flops usually aren't the best because they don't give you any stability. Little ballerina slippers aren't that helpful. Something that can be helpful for plantar fasciitis is something with a little bit of a heel. If you have a heel, that's going to take off some of the pull of the muscles in the back of the calf. Now I want to show you an example here of someone before having a heel stabilizing orthotics and after. You can see this line that's in the back of the calf here on the upper left-hand corner, and on the heel region it kind of goes to the side. And because it kind of goes to the side on both sides, they're putting a lot more strain in the middle of the foot. and in the arch of the foot in the area of the fascia. By using an orthotic, what it can do in those lines is it can straighten things out. So the heel goes out, and then with an orthotic in a nice shoe, it can stabilize things. Now I want to focus on this. Not all shoes are created equal. Not all shoes that say they're going to cure your plantar fasciitis are going to cure it. A shoe isn't the key. The shoe, or even orthotic, isn't the heal all. It's not going to heal everything with just one orthotic. Okay? We tend to use more of a custom-made device, but other people, you can find an over-the-counter device that can be helpful as well. If no shoe or orthotic helps you, the problem is probably because of the inflammation hasn't been taken care of. But orthotics can be very helpful at treating this. I want to talk about a couple of advanced treatments here. This is one that came out recently, and it's been used in different parts of the body. It's called an amniotic tissue allograft. So basically, it's a piece of tissue from someone else of the same species, okay? So another human, a human female. And what they do is they take this amniotic membrane, if you can see on the picture, the amnion and the chorion, you take that little membrane, okay, that is sterile inside of the mother after a birth, okay, they're consenting to this. And if you ever notice with a baby, even if they have to have you hear of them having surgery inside the womb and then there's no scars, it's because inside there's a lot of growth factors that help reduce inflammation and scarring and help improve healing. And these growth factors, they can be used to help your own body heal. So this is actually coming in a powder or a liquid form, and you take it and utilizing the ultrasound guidance, you can inject it right in the area of the plantar fascia. For people, let's say they've tried the cortisone, they've tried the orthotics, they tried everything, and they're wanting to avoid a surgery, this is where this would fall in for this type of a treatment. There's really no downtime. Most people, we do put in some type of a boot to rest the foot, but there's really no downtime. The only downtime is usually it's not covered by insurance and can be a little bit expensive. Another advanced treatment that's being used is something called hydrocision. To make it simple, you can see this diagram. There's some saline, which is like a liquid of water that comes down, and it goes into this hand piece. And this hand piece is made in a way that it's actually shooting out water and then it's sucking it back up. So it's basically going in a loop where it shoots the water and sucks it back up. And when you put it in the area of the fascia, if you look in the ultrasound, you're going to see areas of inflammation, areas where the tissue is injured. And by putting it in the area of the fascia in that area, it's going to take out all that damaged tissue. That's how it works. The benefit of this procedure with the hydrocision is that it's minimally invasive, and there's really a reduced recovery time compared to a bigger traditional surgery. The recovery is usually about 2 weeks for this type of a procedure. It's still done in the hospital. That other one we talked about with the amnion can be done in the clinic, but this tends to be done in the hospital. It could be done in the clinic, but sometimes it's hard to get rid of the waste because when it pulls out that tissue, that's some waste that needs to be disposed of. And then the last type of advanced treatment is a plantar fasciotomy or plantar fasciectomy. Basically what this means is there's a little chunk, you can see that little red piece, you imagine you could take out a section of the plantar fascia that can loosen the fascia up, and that for many people can help. But this has a little bit longer of a recovery. It involves some stitches. The previous one has a couple of stitches as well, but this is another type of a treatment. Now this is in no means is supposed to be complete about the surgical treatment or even the non-surgical treatments for this condition, but just to get you an idea, there are a number of treatments, and it's good to go through and kind of see what you've done. And what's helped you and what hasn't helped you. And what I find really helpful with my patients is I go over this little algorithm here with them. So I say, well, have you had an x-ray? Okay, good. Is there a spur? Is there not a spur? Is there any other issues going on in your foot? Because there can be other issues. Did we do a diagnostic ultrasound to measure the thickness of it? And then did we do treatments accordingly if there was thickness in the area? And then if we're thinking about surgery, for some people, it doesn't have to be everyone, we'll get an MRI. Just to see the area of inflammation, just to confirm what we have going on. Then the traditional treatments, reducing inflammation, icing, anti-inflammatories, cortisone injection, I put that little thing there for 8 weeks. I like to wait about 8 weeks. Some people it can be 2 weeks, but it really just depends on the patient. One thing we didn't talk about is a walking boot. Basically, that's one of those Darth Vader looking boots. It's a big boot that you wear just to rest everything. That's something that can be tried to reduce the inflammation. I don't like everyone to be in one of those, but for a lot of people it helps. The shockwave therapy, or that EPAT therapy, is something for people, let's say if they've done the cortisone and then you want to do something else in the mid-time between the 8-week period, or it can be used primarily too if you don't want to do the cortisone therapy. Okay? And then reducing the tightness, the stretching, the foam rolling, the physical therapy, the home therapy, the night splint, those are all helpful. I can't really emphasize the importance of finding a good physical therapist. Not all physical therapists are created equal. So if you go to one place and you say, oh, they really didn't do anything with me, they just kind of made me ride a bike and nothing really happened. Well, sometimes it might be the specificity of the physical therapist that you went to. You need to go to someone that kind of knows how to treat this condition and treats it a lot. Also, stabilize and heal. The first I try is a nice stable shoe, athletic shoe, and then it could be a custom orthotic that goes inside of that. If you've tried all of these things, then it's time to consider some of these other advanced therapies, like the amniotic tissue allograft that we talked about, hydrocision, and then if it lasts over 12 months, surgery might be indicated for you. Surgery is always the last resort. 99% of these can get better without surgery, okay? And then sometimes you need a second opinion, because we talked about plantar fasciitis. But there are other things. There are nerve-related issues that can cause this problem. There are other types of issues that can be involved, like Achilles tendonitis. So this isn't supposed to be complete. It's just kind of an introduction. And what I put down here is, this is a post-wire. Basically, this is a page that has some more information. And I'll include this on the bottom of the screen or on the bottom of the video. If you're watching it, you go to on the area of plantar fasciitis under my resources, plantar fasciitis, and you're going to find a page with the videos that we talked about to explain the foam rolling, about all the different types of treatments, and that's more complete if you're interested in learning more. So thank you for watching this episode of Healthy Living. Thank you. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see, and then also there's a little survey.